Hello, everyone. Welcome to our first Instagram live session of the year. I am thrilled to have you all today for an important conversation on thyroid awareness and thyroid health. January marks Thyroid Awareness Month. It is a time to shine light on an essential yet most often overlooked part of our health. Today, I'm honored to have our distinguished guest, Dr. Nada Al Hassawi, on this show. She will help us better understand this vital gland and its impact on our overall well being. Dr. Nada is a global speaker, she is an author, she is a professor and a scientist in body healing. She has dedicated her career advocating for holistic and sustainable approach to health. Hello, Dr. Nada. Good evening.
Hello, good evening, Mrs. Temvi. How are you?
Very well. Good evening. It's so good to see you. Happy New Year.
Happy New Year to you. Mrs. Temvi, I would like to express my gratitude for and thanks for having me in your amazing health, holistic health IG Lives 2025. And I'm really happy in this start of the year.
I am very happy as well, and I'm looking forward for tackling very important subjects throughout the year. And we have the whole calendar planned, and I'm sure the more we get into the year, it'll be much more interesting for everyone to be part of this amazing conversation.
Yeah, looking forward.
Again, thank you very much for joining us today. So without further ado, I want to jump straight in. I would like to ask you the first question, which is the most important question. It's the basic question, basically. So can you please explain what the thyroid gland is and where is it located in our body?
Yeah, thank you very much. And I think thyroid gland is very important. It's very common. The diseases of thyroid gland is very, very common. Many people complain about the thyroid gland, and it's actually a small gland it has a butterfly shape with wings that extend toward the two sides of the throat. And it's located below the Adam's apple. And it's in the throat. The thing is, we need to acknowledge that thyroid gland is one of the amazing endocrine system that we have in our body. It's one of the several glands that they have different locations in the body. However, they secrete important chemical substances known as hormones into the blood. And I would first mention the pituitary gland, which is located in the brain, and that is the master gland. The thyroid gland, the parathyroid gland. We have also the pancreas and the adrenal gland that I always mentioned in terms of the stress hormones. And also we have the sex hormones, which are released by the ovaries and testes. I would like also to mention that the pineal gland is not itself is a gland. However, it's not secreting hormones. The pineal gland is related to the neurotransmitters, just to correct the information, neurotransmitters that are melatonin and also serotonin. So they are neurotransmitters, not real hormones. So hormones should be secreted into the blood. So thyroid gland, one of these glands that secrete these hormones or its hormones into the blood.
That's fascinating. Building on that, could you please help us understand the vital role of this small gland, the butterfly gland that plays in our body, and what's its main functions?
Most people know that their functions from the disorder. The main disorder when they visit a physician and they're complaining about the body, the weight loss or weight gain, directly the physician will ask them to check the thyroid gland, the hormone. So here we can say that the main function of the thyroid hormones is related to the metabolic rate, the metabolism, how our body is using the chemical stored energy, because there is energy in the food, how our body is dealing with this in order to release that energy for our body to use it. And also here, I need to it's very important to mention the hormones that are secreted by the thyroid glands. There are three main hormones, which I would like to mention this tonight. They are important, they are related to most diseases. The first hormone is known as thyroxine. So people, they know about thyroxine. And actually, thyroxine is a stored form of a hormone. It's not, when we say there is a stored form, different than we say there is circulating hormone, which is in the body, circulating in the body. Now, the thyroxine is a stored hormone because it is attached to proteins that are located in the blood. And these known as globulins. They are big proteins. So it's like a stored form of the thyroid hormone. And it is, and also many people will remember also when we talk about thyroid. So this is the common information, however, maybe we want to accurately specify it and explain it tonight. It's related to the iodine. So when we say thyroxine, we are talking about a structure that has 4 iodine atoms. 4 iodine atoms are there. So now the T4 is there. However, it can function. However, the main function is related to what is known as the triiodothyronine. That is T3. So we have T4, which is the thyroxine, and we have T3, which is the it's 3-iodothyronine. So basically, this is the most active, this is the active form.
Okay.
And it's circulating form. It has less affinity to attach to the protein in the blood. T4 has more affinity to attach. However, the job of T4, since it is, whenever the hormone is needed, it will be converted by releasing 1 atom of iodine to form the T3. And T3 will go to the cells and go to tissues and organ and to function. Okay, so here we have T3, triiodothyronine, the most functional form. The T4, which is the thyroxine, we have calcitonin. This is the third hormone. It's released by the thyroid gland. And from the name, we can figure out calcitonin is related to calcium. Yes. Okay. So it is actually involved in regulating the level of calcium in the blood in case of increasing the level. So there is always in our body all the parameters, calcium, sugar, iodine, all the elements has their normal levels in the blood. Now, in case of calcium, when there is an increase in calcium, the calcitonin will function by decreasing that level of calcium back to normal level. And how this actually decrease, we should know that there is always a dynamic movement of calcium between blood and bone, or blood and bones and teeth. So if there is increase in the level of calcium in the blood, say there will be an increase in the calcium disposition into the bones. And that is the job of the calcitonin. That is by thyroid gland. To bring it back to normal, and that is by disposition of the calcium into the bones by cells known as osteoblasts. Okay. So this is the third hormone, and that's the main function of that third hormone secreted by the thyroid gland.
Perfect. Thank you so much. I think many of the viewers now might be concerned about thyroid conditions. Could you walk us through different types of the thyroid disorders, like you mentioned before about weight gain and weight loss?
Yes.
Any thyroid disorders that people might commonly face?
Yes, thank you very much. This is very important point. I think mostly when we talk, our talk tonight is mostly about the awareness means diseases and how we can protect ourselves from getting the disease. That's why for me it's interesting and it's very nice. So we can classify the disease into 2 types of thyroid diseases, the primary and secondary. Okay. When we say primary, it means that the origin is the thyroid gland itself. Okay. So the problem is in the thyroid gland. When we say secondary, the problem from another factor, which is mainly pituitary gland, affecting the thyroid gland. I understand. This is the pituitary gland now, the master gland in the brain. Is very important. Sure. So here we need to highlight how actually thyroid glands, thyroid hormones are secreted by the thyroid gland. What is actually mastering this is the pituitary gland. By secreting the thyroid stimulating hormone. And most people, when they suffer from these kinds of problems, they would know, because now it's like anybody's affected by disease usually will go and try to understand what doctor is saying, go to the net. So maybe they are familiar with TSH. Yes. That is the thyroid stimulating hormone. Yes. It's released by the pituitary gland. However, not only the pituitary gland. The pituitary gland is also controlled by the hypothalamus, which is in the brain. It's a region in the brain. How hypothalamus is controlling that secretion by the pituitary gland in the brain by releasing what is known as the thyroid releasing hormone. So that thyroid releasing hormone by hypothalamus, when it's released, it will affect and will stimulate the secretion of thyroid stimulating hormone from pituitary gland. And that thyroid stimulating hormone will stimulate the secretion, will go into the blood and stimulate secretion of thyroid hormones from the thyroid gland. So when there is a problem, of course, in the secretion in the thyroid stimulating hormone from the thyroid gland, the pituitary gland, that will be the secondary factor or secondary disease. So to give example, to just maybe clarify it more, if there is a problem in the thyroid gland, because most people would suffer from the hyperthyroidism or hypothyroidism. Hyper is overacting. For example, if there is hyperthyroidism, overactive thyroid gland, it means there is excess secretion of the thyroid hormone. This could be due to nodules or what is known as lumps, like overgrowing thyroid cells. Problem similar to could be non-cancerous, not important to be cancer cells.
Correct.
Sometimes it's just non-cancerous cells. Overgrowth will cause the overactivity of the thyroid gland, which result in over-secretion or excess secretion of thyroid hormones. That is primary, because the thyroid gland is the origin of this.
Yes. Yeah.
Now, if there is excess secretion, for example, of TSH, the thyroid stimulating hormone from that is a problem from the pituitary gland, which will affect the thyroid gland, and result will be excess secretion of the thyroid hormones, and that is a secondary disease. That's the difference, by giving example. Okay. So that's why maybe later on we mention specifically that test. Usually the test always should include the TSH, the blood test should include the TSH and also the thyroid hormones, both. So to know if this is secondary, and of course more tests should be done in order to determine the cause of the disease.
What our viewers here who are watching us should watch out for? What are the warning signs that might indicate there is a thyroid problem or an issue going on in our body?
The number one, of course, mostly there is unexpected weight gain or unexpected weight loss. That is the known. Most people, they even mention it. That's the general information, because mostly thyroid gland is related to the metabolism or metabolic rate, which is how our body is using or dealing with the energy stored in the food and to be used. That is, I would say, this is the rate or the speed of the metabolic rate or metabolism. And also, if we also mention the function, because mainly we focus on the major function, but also there is other functions. The heart rate is also one of the functions of the T4. And the heart rate, when there is an increase, rapid or slow heart rate, this is another symptom. Also, the brain development. Nobody knows the thyroid gland related to a brain development, and especially in the infant. That's why there is a specific or the special disease for the infant known as a cretinism. Cretinism, when there is the iodine deficiency during pregnancy. The infant will be like the cases of the characterization of that disease is mental retardation because of the lack of iodine, which is needed by the thyroid gland in order to synthesize the thyroid hormones. So the mental retardation, also there is a slow growth. That is another disease. Also, depression sometimes. The good physician even will tell the patient to go and check thyroid hormones levels in the blood, and also TSH. This is another cause of depression or even in anxiety. Also, the difficulty in tolerating cold or heat. Sometimes there is difficulty in regulating or tolerating the temperature, and that is another function of the thyroid hormones, which is the body control, body temperature. Also, there is irregular menstrual periods in females. Also, it's related to fertility. Also, the mental activity is also one of important functions of the thyroid hormones. Digestion, these are another function. So here we see how much is the thyroid gland important, and it's very important to have, if we have any of these symptoms, very important to check the thyroid hormones and the TSH level in the blood.
Yes.
Maybe I will elaborate also a little bit, because the diseases even is like common. So I thought maybe I'll give more information about the causes of each of the common diseases of the thyroid glands, or I would say disorders. Because disorders may be something wrong in the body that prevents the function of that specific gland on any part of body. We need now at this stage, I think maybe we'll have a special session to talk about the causes, the real causes of diseases, because most people, they would think that this is the end, or maybe it's just a materialistic thing and there is no real causes. And what is the hidden cause? I think that's the aim of this amazing IG Live, because mostly here we are talking about, really we are maybe I'm highlighting this important issue, health issue, and maybe we can find most of this information online, and internet, but maybe mentioning that in this IG Live is like shortcut for people, but still we need to understand what is hidden under this important issue.
The root causes, we will discuss those root causes.
Yes.
As well.
Now, in case of the hypothyroidism, hypothyroidism and hyperthyroidism. Hypothyroidism, that is underactive. We can say it underactive thyroid gland. And the main cause, it is one of the important causes that there is no activity. The cause is the autoimmune disease known as Hashimoto's disease. And that is Hashimoto's disease is a genetic disease, 65% genetic. Now, why I'm mentioning this, because after which, these are considered to be causes, but we will talk about the reality here. That's why I'm mentioning all these causes. So autoimmune disease, Hashimoto's disease is a genetic disease, 65% of the case genetic. Also the thyroid inflammation, another cause, which will cause the hypothyroidism, or we can call it the thyroiditis. That is the term of the thyroid inflammation. Iodine deficiency, because mostly the physician will treat with the iodine. We call it iodine replacement, that they would treat with iodine. Most people, they have hypothyroidism, they have iodine deficiency problem. And also it is non-functional, could be non-functional glands even from birth. And if there is also the hypothyroidism, maybe there is a treatment of hyperthyroidism, over-treatment will cause hypothyroidism. Sometimes from treatment, it will happen from treatment. Also for those people that they had a surgical removal of the thyroid gland, they would have also hypothyroidism. Now for the hyperthyroidism, also another genetic or another autoimmune disease, which is Graves' disease. That is autoimmune disease. And maybe there is a thyroid nodules or lumps which will activate the thyroid gland, which results in the excess secretion of the thyroid hormone. Also the thyroid inflammation and excess iodine. They would say excess iodine, which could be from diet or even from medication. But now my question, I think mostly medication, because there is also a good source of the iodine from food. Maybe we can mention it at the end as a lifestyle, but still there is access. However, my understanding and what I think, most of the iodine, the excess iodine, will come from the medication. Because it's still diet, to me, it's like diet is the natural thing. And still, even we can't, even if we eat excess, still it's not that dangerous like the medication, especially in the iodine medication, because there is iodine medication. And also, over-treatment of hypothyroidism will cause hyperthyroidism. And sometimes there is a benign growth, same as the cancer cells, but they are
They're
not
benign.
cancer, but
Yeah.
benign growth,
Yeah.
benign. And there is goiter. That is
Yes.
another one, which is enlargement of the thyroid gland.
Yes.
And of course, I already mentioned the cretinism, and the thyroid cancer is also another disease. So this just to give more, explanation about the thyroid gland diseases.
Thank you very much. If someone might have these thyroid conditions, what tests should they ask their healthcare providers for?
Yeah, usually it's blood test. Most of
Okay.
the cases are going to be blood tests to measure the level of the TSH, the thyroid stimulating hormone that is secreted by the pituitary gland. And I can mention also the general range, even though it could be different from one lab to another lab. Maybe it depends. But it's within the range of 0.5 to 5 milliliter unit per liter. This is the way how this is the unit that is used to measure the level. Also checking the T4 and T3. This is another test. So here, if we check all, we can make sure that if the problem primary or secondary, this is important. Now, T4 is much more than T3. Why? Because it's the form that is already there in blood. Whenever it's needed, there will be release of the one iodine atom in order to produce the T4, T3, which is the active form, which I already mentioned at the beginning.
Yes.
So yeah, T4 will be like from 5 to 12 microgram per deciliter, and T3 is much less, which is 71 to 180 deciliter nanogram per deciliter.
Okay. The current approaches for treating thyroid conditions, and what's the difference between treating symptoms versus healing the underlying conditions, which are the root causes?
Thank you very much for this amazing question. Treatment, just normal, all the sorts of treatments in the clinic, which is starting from surgery, giving medication, IUD medication, hormonal replacement therapy, chemotherapy. All these are treatments. However, mostly these are like dealing with directly with the disease. Like here, we talk about materialistic level, and we are not against this, because this could be sometimes could be done urgently. Apart from surgery, which is sometimes we can solve many health issues without doing surgery. I would say here that maybe you ask about the healing, which is different here, right?
Yes,
that
yes.
was the question.
Yes.
So healing is to, set the patient free from disease. Because maybe I will elaborate now by mentioning the causes, because when you go to the causes now and mention them, we can understand what's the reality behind these causes, what's happening, why there is autoimmune disease. And it could be genetic, and sometimes here we talk about parenting, Mana. Genetic, it's parenting.
Yes.
And if we talk about inflammation, this is also important. And if we talk about the birth, now we will leave the iodine deficiency maybe aside, maybe we'll mention it later on.
Yes.
And maybe I'm doing my best to put everything together, all the causes that mentioned as causes of having the thyroid gland diseases. And also when we talk about, this is very important thing, that women in general are more likely to develop thyroid diseases than men. This is important also. To me, this will confirm, this actually confirming the understanding of reality behind these diseases. These are not diseases, these are results. The autoimmune disease, inflammation, women having more the thyroid problems more than men. Also the childhood. I'm talking about the genetic factor, or the what you call it, the child, the cretinism, that disease. All these are results. Results of what? Results of the subatomic reason or real causes of having the thyroid gland diseases. If we talk about, frankly, in general, most people who are dealing with the mental problems, like we are dealing with this mental and physical integration. We'll understand that thyroid gland is related to expressing yourself. I took many sessions in the thyroid gland. Many people, they come to me with the thyroid gland problems, and then when I sit there with them, I discover that they can't express themselves. It's not expression in terms of let's say it's important to express the anger, or sometimes not, this is the point, but the point expressing yourselves in terms of your highest value, in terms of your soul. So if you also search more into it, Mr. V, because I search many people really looking forward, yani, I am like searching in, in what those papers or the books that are written by physicians that really love medicine. They highlight something related to the work, because we know we have 7 areas in life, and one of them work, health, money, social, family, all the spiritual, they are important to us. So work is meant by the pituitary gland, by the thyroid gland. Work. I would say not only work. The work should be related to what you created to do on earth. So expressing yourself by expressing your highest value. Expressing your highest value. Because we are all speakers, writers, and researchers in our highest value. If we don't express the highest value, that's a problem to the thyroid gland. This is the way, how, this is the only solution, this is the only healing key. How to set ourselves free from the thyroid diseases is to express, to discover who we are as a souls. Then we can express ourselves and then we will see that there will be healing process will take place, and we should focus on this expression, not on the healing, because some people say healing. No, this is not the way. They should focus on the work.
Yes.
So expressing yourself is the healing of the thyroid gland diseases, but at the same time we need the treatment in special cases. If this age, because if there is, we can't say that there is no treatment is not important. We can't ignore treatment, because the treatment still is a value to us. So there is people helping us, they have value in treating people, and there is people who have value in healing people. So they should be both together at the same time, at the same time. So this is I would say, healing start from this point. Yes.
To understand who you are and why you are on this earth. That is the main important thing. If you understand who you are and you discover what your purpose is, that's the highest value. That's something that you are here, and God has made you to fulfill that duty. This is your highest value. And I absolutely agree on what you just said. Actually, thinking about what you said about World Health Organization, I was also going through an article, and I was going through, they were saying that according to World Health Organization, there are 750 million people currently with thyroid conditions. And that's a staggering number for people to have this kind of disorders, any form of disorders of thyroid.
Yes.
And it is very, very big number.
Yes.
And it is often overlooked. Many people don't even know about that they are suffering from any sort of disorder in that sense. So I would like to ask you here, is there any commonly cited causes for this particular thing, that why so many people, as you said, there's autoimmune disorders, there is a lot of other causes. Can there be some sort of environmental factors or lifestyle influences as well?
Yes, thank you very much. What you mentioned already, that number is huge, Mrs. Temvi. My question is this number worldwide, or is it in US?
Worldwide, 750 million worldwide. Yeah.
So people, they are suffering from this not expressing themselves.
Correct.
And that's why I mentioned the women, because women mostly sacrifice. So how they can express themselves? And expressing themselves, again, Maybe I would highlight this, not I'm anger or I'm angry or because I'm doing this. This is different. This is balancing yourself, balancing your emotions. However, expressing yourself, that expressing the highest value. This is the key number one. Key allowing is not, I know it's not easy, but you need to, everybody needs to allow him or herself to express, to do, you know, to go ahead and express themselves and really know who they are as souls. Now, you ask about the site, or you ask about the information or something about the causes.
I was asking you if there is any environmental factors also, maybe
Yeah.
some lifestyle choices
Yes.
that can also
Yes.
become causes of thyroid.
Yeah. Now, if you mention, of course, I mentioned the causes here,
Yes, but
but again, we said these well-known causes, they
yes,
are result of stress.
correct.
Again, this is the stress here. This is the stress I always highlight. Now, 7 years, I'm talking about elixir of life, talking about the stress. And mainly we are here, thank you very much for the cooperation, talking about the emotional stress, not the sudden or the other acute stress when we see lion, because
Yes.
that one still is, yeah, it's healthy because you protect yourself. But when we talk about the emotional stress, that's the issue here. That's the environmental factor. When we think that the news and everything around us is affecting us, but it's inside us. We are suffering inside. We're not expressing ourselves with what we were created to do on earth. At the same time, we are not balancing our emotions. We think we always focus on the negativity. We don't balance it with the positivity. So here, the stress is number one causing the autoimmune disease, because even if we dig into many papers and really understand the mental cause of the autoimmune diseases, it's like I am working against myself, like I hate myself. It's like again it's myself. So it's like the expression of the body will come after this this mental thought, and will reflect on us by auto. It's like the auto. It's autoimmune disease, like diabetes, like any other disease, autoimmune. It's really, it's expressing our thoughts. So this is the stress. This is stress. And it's like the other one, the inflammation again. And of course, all this expressed by the stress hormones, adrenaline, noradrenaline, and cortisol. And inflammation is also by cortisol. We know that. It's acute inflammation. That it's meant, inflammation is good process, by the way. It's when it's happened, when it's acute, it's excellent. When we have cold, we would have inflammation, process of inflammation that will try its best. That's a mechanism inside our body to rebalance our internal environment in the body. That's why we need to relax, to give it a chance. The energy should be spent in this rebalancing to fight, for example, a virus or bacteria or whatever. But when this happens, the body can't do it because the stress is already there, the trauma is still there, the cause is still there. So the body is still rebalancing. Inflammation now is chronic. So it's dangerous now. It's dangerous. So that's why we have this problem. If we talk even about the inborn defects, like the inborn defects that having the non-functional thyroid gland, again, this is the reflection of our stress on our the embryo, or even the
For our parents,
cells,
for our
for the
parents, if
parents,
they
for
are
the
in stress,
parents.
yeah,
So
yeah, yeah.
also they are like transferring this stress to the child.
Correct.
Yes.
Correct. Yes, like in our previous conversation last year, when we had this conversation about epigenetics, and we really put our full conversation on the epigenetic factors and
Yes.
how they can be triggered. This is all comes from stress. It's not only the stress can activate everything. I mean, even if we feel we are not in stress, but when we were in our mummy's tummy, maybe our parents at that time were in a stress situation, and
Yes.
that was that came to us, and that became other disorders or what we carry in the later years.
Yes. Also, I would like to highlight now, because I think there is interesting also questions.
Yes, yes.
The sacrifice in the woman, this is very important, because
Correct.
mostly we said women, they are suffering from thyroid gland disease than men. Sacrifice, men, most people, they think it's a good thing. It's giving. That's the thing. It's giving rather than sacrificing. I always define sacrifice as when women, they stop from doing what they love to do, what makes them, brings the fulfillment feeling. And that is the real, when they sacrifice this, they live in pain, of course. And pain means the emotional stress. So emotional stress is also number two. When we don't balance it, we don't live our highest value, we don't enjoy, we don't have goal in our life, and we just sacrifice our life to others, and there is, at the end, there is expectation. That is the real pain. That's the pain, and that's the thyroid gland, when even any other disease. So now, if we highlight now, this is the environmental factor, of course. Environmental factor, when we blame others and we don't really try to balance the conflict between our heart and mind.
Yes. Also, can you take us through some lifestyle practical managements? Maybe say for example, if there are any lifestyle causes, maybe some food or something like that.
Yeah.
If you can just take us through some lifestyle choices.
Yes, thank you. I would highlight something. Maybe people will have excellent lifestyle now, getting enough iodine from the diet, eating enough seaweeds, because seaweeds are rich in iodine. When you talk about the different seaweeds like kelp and nuri, and these sorts of commonly known seaweeds. Also, some certain fish, they are rich in iodine, like cod fish and tuna. And maybe the shrimp is good source of iodine. And there is also the salt in the supermarket. There is iodine added to it. Add to it. So they are a good source of iodine. But maybe if we even take the good source of iodine, and also we have balanced food, and we exercise regularly, and we stay out of pollution, and we sleep early, and we come early, still many people, they have this lifestyle, but they would also have the thyroid gland disease. So it's number one.
Unless you know who you are and you love what you do and you keep doing it, you keep doing the value. These environmental factors are in balance. These lifestyle choices automatically align with it.
Yes.
Yeah.
So this is thank you very much. This is number one. Having kind of that the calm lifestyle, I would say. It's like contemplation all the time. You contemplate, you understand, and it's like too much. It's like, now I think it's a journey, and everybody has to have this journey to enjoy it. That's the life journey.
Yes.
When you go back and you set your mind free, the mind that you raise on it, the program, it's like you're going back pure. Because the more you understand, you'll go back to the reality, understanding things, understanding the reality, and thank you, because we need to acknowledge in this IG live Mr. Ahmed Fadl and Mr. Dr. Muhammad Muadhan for what they gave us, this VMG amazing methodology. Talking about human behavior, talking about mind, and from this, I just found what I really love to express. It's like the healing and the reality about health and all these diseases that are affecting humanity. And I think it's like a value now for physicians, but who knows, maybe in the future, physicians will have this talk. Who knows? Maybe in the future, we won't need any medication.
I hope so.
Hopefully.
That would be a perfect world, isn't it? I want to tackle it a little bit on the lifestyle changes. If we would like to, would you like to, recommend for people who already have been diagnosed, or they are trying to prevent any thyroid conditions? What lifestyle choices would you recommend here?
Yeah, of course, I would say number one, of course, the test and the checkup and going to the physician. is important. Taking medication is important, but this very important critical point. Maybe I'm very, I care that people, they don't rush into surgery, I have to say, unless it is urgent, urgent. Because there is solution, of course. Healing is there. It's a hidden mechanism inside our body. Once we understand the key and we activate the key, and that is inside our heart, and that's what we love to do, they need to enjoy life. They need to stop worrying, stop all this what actually distracting them from doing what they love to do, and they need to understand the real thoughts behind many emotions. Because people, to be honest, the emotion itself is the fingerprint of the thought. What remains is the emotion, because always when you have thought, we work on the thought, we understand it, but sometimes the emotion will still be there, little bit, traces is there. So we need to understand, the more we look into future, the gap, it's like if we have that emotion, the less the gap, the less the emotion, we will look forward more and we'll have no emotion. So now we can override the emotion because the emotion is still be there even if we balance the thought. So we need to work on this. Understanding this will make us move on and carry on and understand that this life is all. We need to forgive us and understand that what we pass and all the experience is are lessons. So we need to understand the lessons, and we need to move on and enjoy life. And to be honest, to me now, the real life is our values. Nothing is there. Enjoy the values. This is the main key of the spirituality between me and God, the values. Because values is a real manifestation of the beauty and the unconditional love. So that is the real lifestyle we all need to do that shift. We have to start with V and M with G and G, and we keep repeating the same thing because it's very important message. We'll never stop to deliver this message until it's really understood. I hope many people really understand it, and it should be worldwide. Yeah,
I agree, absolutely. And I think if any of the viewers would like to know about this methodology that Dr. Nada is talking about, which is the VMG, these three powerful alphabets, please connect with us. It would be lovely if you connect with us, and we'll be happy to answer any questions and answer any queries. And I can even connect you with the right people, the right experts for your issues and for your talks, who you will be comfortable talking to. Okay, before we wrap up, there is one more question I would like to ask you, Dr. Nada. Is there, as this is January, is Thyroid Awareness Month, as I started this conversation with, what final message would you like to share with our viewers about thyroid health?
Yeah, thank you very much. I would say for everybody, stop the emotional stress. Try to understand thoughts that drive this emotional stress. That life is negative and positive. And we have to accept it. We never, because most people, they say, oh, I believe in God and it's okay. I believe and I accept what God, like if anybody, like you lose people who you really love. And you say, oh, I accept that, I believe in God, whatever. No, it's like doing. It's not knowing and doing, like Mr. Ahmed always say, doing and knowing, completely different. This is knowing. You just say it. You need to act. You need to accept it. You need to move on. You need to appreciate the person who gave you, for example. And that's life. That's life, Yani. And this is number one. Number two, we need to discover ourselves. We need to really have goal, and we need to express our highest value, who we are as souls. Of course, treatment is important. And as I said, sometimes in emergency and urgent cases, we need to listen to the physician. But spirituality is important also at the same time. But what is spirituality? Spirituality when you activate what really God asks you to do, and that's in your heart. So God is talking to us through our heart. So in our heart is our message, what we really need to do here on earth, what we really activate here. We need to set ourselves free from sorrow, from guilt, from sacrificing, from anger, and life will go on. And everything and everybody, every person, every experience had its own reason in our life. So we need to appreciate our life. We need to appreciate them. We need to be happy, and we need to activate our inspiration and living in sustainable health. This is important.
I absolutely agree. And we've received a message. I think I will leave it. I will not talk about it because it is, I would love if the person who sent me this message, if you can connect with us directly, and I will be happy to connect you directly with Dr. Nada and our other experts, Mr. Ahmed Fadl and Dr. Muhammad Al Maidin. I'm sure if there is something that you would like to discuss with them privately, we would be happy to, connect and discuss. Thank you so much. This has been such a beautiful conversation, and I'm over the moon to start this amazing year with such beautiful and informative and eye-opening conversations with you, Dr. Nada. Thank you so much. And I think all of us here have now, I feel, a better understanding of thyroid health, what exactly it is, what are its function, this butterfly in our throats, what's the main function, and how we can monitor it, we can heal from the disorders. So for everyone who's watching, please remember, take small steps towards awareness, towards your highest value. And I think any changes, these small changes can bring large differences in your lives. Thank you again so much. And if anybody would like to follow Dr. Nada, she's very active on her Instagram. I will tag her on this post, and please follow her, and she will give you more insights on your health and sustainability and holistic approach to well-being. Until then, take care and prioritize your well-being. Bye for now.